My name is Maureen and I'm part of the team that has been working in intensive care. Your loved one and your relative is going to be a patient in intensive care, and I just want to show you what an intensive care bed space looks like. So these are our intensive care bed spaces. As you can see at the back, we have a lot of plugs, pumps and monitors. Please walk forward with me and I will show you the intensive care bed space that your relative may be in. I would like to show you an intensive care bed space so that whenever you make your Zoom call or when you come up to visit your loved one, it doesn't come as a complete shock and surprise to you. This is our intensive care bed space. As you can see along the back wall, there are a lot of pumps and there are a lot of plugs. I don't want you to look at that. I want you to walk forward with me and then you will see the equipment that I'm going to talk to you about. This is the ventilator. You might call it a breathing machine. The ventilator is attached to a tube which is in your loved one's mouth. It helps your loved one breathe. We're always with your loved one on the ventilator, making sure that everything is safe and everything is well. Now I want to show you the monitor. The monitor is attached up to your loved one. It records their heart rate, their blood pressure and their oxygen saturation. We also have pumps. These pumps deliver IV fluids, medications and drugs. They go in through drips that are attached to your loved one through their arms or sometimes their neck. We call these drips lines. Again, your loved one doesn't feel any pain. All of this is delivered and they're up while they're sleeping and they don't feel anything, so please be reassured. There is always somebody with your loved one 24 hours a day. We're part of a large team that includes nurses, nursing auxiliaries, the doctors, the anaesthetists, the domestics, the physios, the medics and the technicians. There's a lot of us around, so please, we talk to your relative all the time. We tell them what's going to happen before it does happen and we care for them. We're also available to take your telephone calls and explain everything to you. Our voices will sound muffled when you're talking to us on the telephone. That's because of our PPE. So now I'm going to introduce you to my colleagues who are wearing PPE so that you will see what it's like. You may have seen it on the television. It's different whenever you actually see it here. So please bear with me now. These are my colleagues Tracy and Genevieve. They are both wearing PPE. I'm going to introduce them to you now. This is Tracy.
Hello, my name is Tracy. I am wearing full PPE. This is how I sound when I'm speaking to you via the telephone or via Zoom call.
Hello, my name is Genevieve and I am also wearing PPE, and this is how I will sound whenever I speak with you either by telephone or on a Zoom call.
We're all part of our team that I spoke to you about earlier. We're all here to make sure that your relative, your loved one, feels safe and secure. We will be with them, as I said before, 24 hours a day. This video hopefully will help you understand what it's like in intensive care. Please feel free to watch it as often as you feel you need to, and don't be afraid to pick up the phone. We are here to do our best. Thank you.